Okay, I'm here with Dr. Virani, and we're going to discuss today a little bit about how Medicare reductions have impacted his practice in asthma and allergy.
Yeah, thanks, Paul. Thanks for having me. I'm a private practice physician working out of the Fredericksburg area, and this has been devastating for us overall over the past 20. Just to give you a little context to all of this, over the past 20 years, we have been getting fewer and fewer Medicaid payments, even though we're providing the actual same service year to year, and that's really hit us significantly as the cost of everything, as you know, inflation has really taken over for us, and so we are we are trying to survive on what little we can get.
So, are these payments that you're getting from Medicare, are they going up? Are they going down? How does that relate?
No, overall, it's been a downward trend over, like I mentioned, over the past 20 years. I think if you did cost adjustment to inflation, we've lost about 29% from that period of time, from 2016, if I'm not mistaken. And so when we want to bring value, we also want to understand and be appreciated for that, for our time. And when we're working hard for our patients, we would like to at least be above water and be able to keep our lights on and keep our doors open, because we do, as like with other small businesses, employ many other people. And I think it's important for not only for our patients to get the best care, but our staffing to also get the best care that they can as well.
Absolutely,
Yeah,
thanks. And
thanks.
not only when we talk about Medicare, not only do we talk about getting paid, but a lot of the stuff that we do will actually save Medicare money.
One.
So if patients can have access to board certified allergists to care for them, then it's going to cost more because it's emergency rooms and
Yep.
hospitalizations and all of those things. So one of the things that's important that we can do quickly is concerning penicillin allergy.
Yeah.
So I'd like to bring in Allison Freeman, another member of our group, to talk about the PAVE Act.
Thank you. I am super excited to be here on Capitol Hill today to get more and more co-sponsors for the PAVE Act. This bill can save the Medicare system a vast amount of money. When patients in America go through life believing they have a penicillin allergy, it leads to increased costs of their hospital and personal care, but also increased drug resistance and many other negative side effects. We can show patients with a very easy assessment in our office that they're actually not allergic to penicillin. And up to 96% of people assessed in our practices come away from that assessment no longer allergic to penicillin. That can result in an enormous savings for the Medicare system. So that's why the PAVE Act has been proposed, that every patient going into Medicare would now get a referral for penicillin assessment at an allergy office. But furthermore, once we get those Medicare patients in and save the Medicare system money, we want to do the exact same thing for young children and pediatric patients, young adults across the country who may mistakenly believe that penicillin allergy is a lifetime problem.
So, Allison, you're saying that 90% of the people you see with penicillin allergy leave no longer being allergic to penicillin. Is that something you do, or is that something that their history was wrong? They weren't really allergic.
Sometimes it is the history, but I think the biggest part is that we have come to understand in the last 30 years that a lot of the time when an acute skin rash or reaction takes place, the underlying infection can be equally to blame. And we, with simple penicillin testing and penicillin rechallenge, can show those patients that they no longer have to go through life avoiding this essential drug.
And can patients outgrow their penicillin allergy?
They absolutely can. We believe that's possible for a majority of patients.
So you're saying then that 90% of the people that show up with that I'm allergic to penicillin label probably are not allergic.
And that's 2 or 3 people a day in my practice. And
Great.
so it's a huge number of people in America.
All right. Thank you, Dr. Freeman.
Thank you.